Thank you, Dr. Ling. So,
can I present my second presentation
yes.
now?
Yes, we are ready for your second presentation, please.
Okay, thank you. Can you see my data show?
Yes, we can see it. Perfect. Yes.
Okay, thank you. Now I will begin my second presentation entitled Chakras Energy Deficiencies as the main cause of myocardial infarction without arterial obstruction. This study was also based on Hippocrates that said that it's important to consider other ancient medical traditions prior to the knowledge we have nowadays. And a myocardial infarction without non-obstructed coronary arteries is the term currently used to describe patients presenting with the clinical features of acute myocardial infarction, but without evidence of obstructive coronary artery disease on coronary angiography. This situation is found about 6% of all patients with myocardial infarction. However, these cases is large variability and its reported prevalence, but a range of 33.5 to 15% possible attributable to differences in the studied population and heterogeneity in the definition. It is also more common in younger patients and women. The physiopathology in the energy level is believed to involve the production of internal dampness and phlegm that leads to the internal obstruction, including chi stagnation and blood stagnation. And the formation of dampness and phlegm comes from the imbalance of the spleen meridian, a massive organ of the 5-element theory. In this study, I will show you a case report of a 60-year-old woman that began to do acupuncture from her husband's recommendation that was already my patient after being kidnapped here in Brazil, and she was very scared and stressed. And after, I decided to evaluate her chakras energy, meridian, and all her chakras were in the minimum level of energy, like in the first presentations patients that were in the lowest level of energy. Here is the result. Only her spiritual chakra has energy. And during the acupuncture sessions, I noticed that all her acupuncture points that I inserted the needle was being purple, but and the patient was using aspirin. And after this, that she reported to me that she had 3 episodes of myocardial infarction in the first in December 2019, and the second 2 months after in the January or February 2020, and 2 months later she had another myocardial infarction. Here. In December, she felt pain in the chest and irradiation to the left upper limb, and the doctor decided to submit her to a coronary angiography that resulted in a normal exam. On February 2020, she had another episode of chest pain and was submitted to the same coronary angiography, and they decided to put in a stent. On March 2020, she was kidnapped, and she had after she had another chest pain, but the coronary angiography resulted in normal again. 2 months only in the second coronary angiography, they say to her that it was 70% obstructed, but as the first angiography was normal and the third was normal, she is asking if this result is real or not. And I did the Chinese dietary counseling, all to improve the absorption of nutrients from the 50th chakra or spleen, because all her chakras energy were in the lowest level of energy. And it was oriented her to avoid all raw food, dairy products, cold water, and sweets, and also to avoid the raw fruits, because all these fruits and vegetables has cold energy, and cold energy can induce the formation of phlegm, that one of the cause of energy imbalances that can lead to myocardial infarction without arterial obstruction. And you can see that this Western medicine orientation is always to orientate the patients to eat more raw food and more raw fruits. And these kind of orientation are leading to the formation of more phlegm that can induce more formation of arteriosclerosis and the formation of obstruction in the energy level. And also, it was oriented to patient to drink more lukewarm water and avoid the cold water and coffee, soda, matcha tea, because all these drinks could induce the deficiency in the yin and yang energy, leading to less energy to the blood flow normally inside the vessels. And here's to demonstrate that the foods with flowers such as broccolis or cauliflower was oriented to eat but not raw. Eat like steam. Broccoli is better to do not worsen the absorption of nutrients in the spleen, and also this is to tone the energy of the lung. That it's better to eat foods with a flour. And also to orientate the patients to avoid the fried foods, egg, chocolate, honey, coconut, to not cause imbalance in the liver. And when you cause imbalance in the liver, you can lead to imbalance of the heart, because the liver is the organ before the heart that sends energy to the heart. And when you imbalance the liver, you will imbalance the heart meridian after. And also to orientate to avoid the chocolate, egg, honey, coconut, alcoholic beverages, to don't imbalance the heart meridian also. And here's to show you sweets and cold water can induce spleen and pancreas deficiencies. And also, I did the replenishment of her chakras using homeopathy medication according to this theory, constitutional homeopathy of the 5 elements based on traditional Chinese medicine, that you can find online. This new theory in homeopathy, that I use this kind of medication to replenish the chakras energy, and also some crystal-based medications. Here's to show you again the Arnold Schultz law, why the use of high diluted medication instead of high concentrated. Because as the patient has energy deficiency inside the chakra, if you use more high concentrated medication, you can reduce even more the vital energy, leading to more propensity to have another myocardial infarction, because the blood to flow inside the vessels, you need to have the I think it's in another presentation, that for energies of yin yang, qi and blood needed to be in an adequate amount. And to blood to flow, you need to have yin, yang, qi, and blood in harmony, in equilibrium. And if they are imbalances or deficient, the blood cannot flow inside the vessels and stagnating some part of the body. Could be a stroke, could be a thrombosis in the lung or in the abdomen or in the legs. And in this case, the blood stagnates in the coronary artery, leading to myocardial infarction. And the cornerstone of the reasoning used was that patient with leg pain and glaucoma. I want to repeat again his history, because we are treating not the leaf, but we are treating here the energy deficiencies that is not producing adequately in young Qi blood, and leading to myocardial infarction. Even without arterial obstruction, they are the blood is stagnating in the coronary artery, in the heart, because of lack of energy in this patient, and leading to this result. And this situation, I think it will become very common. You can see that nowadays we have many patients dying because myocardial infarction. Even younger patients, you can see that some patients that receiving vaccination COVID-19 can have the myocardial infarction suddenly, not because of vaccination, but because of these energy deficiencies that I said the majority of our patients we have nowadays due to the influence of the electromagnetic radiations that are in the entire world, in many, in all the countries, all houses, all places that you are going, you have electromagnetic radiation that are influencing in your energy that you cannot see, but you can know that they exist, because if you go to some place that do not have Wi-Fi, your cell phone will not work. But it's the same thing. If your body do not have energy, your organs will not work. It's the same reasoning. Here's to show you the necessity to have these two energies in young Qi blood in mind. That is the main theory in traditional Chinese medicine, to understand why patients with that do not have myocardial infarction can have arterial, can have myocardial infarction without obstruction. Here's to show you how we can do the energy deficiencies diagnosis in our patients. These I usually do 5 questions in the first appointment of my patients. If the patient do not go to the bathroom, to do not have daily bowel movement, this could mean blood deficiency. Qi deficiency is when the patient have abnormal sweating during the day. Yang deficiency is when the patient feels colder, mainly in the extremities. And Yin deficiency is very common, like in women in menopause, when they have hot flashes. And heat retention is when you can see the patient have red marks in the skin, like acne or redness in the skin, or bleeding gums, bad breath, and abdominal pain, and itchiness, and microhematuria. All these are signs of heat retention. And this is the sign of the heat retention when the patient have inflammation in the gingiva. This is a sign of, and the gingivitis is not a local manifestation, it is a manifestation of heat retention. It is a systemic disorder. And here's to show you that all the elements inside the body is interconnected by the energy flow, different from the Western point of view. And to show you the generation cycle, the medication to replenish the chakras energy needs to be in this sequence. You need to treat the heart using medication to treat the wood first, phosphorus, sulfur, calcária carbônica, Cilicia, and Natrium muriaticum. I think this kind of medication are even better than the Chinese herbs nowadays, because Chinese herbs can have giving Chinese herbs to the kind of population that we have nowadays with these energy deficiencies could induce more internal heat, because Chinese herbs are considered high concentrated medication and can reduce even more the vital energy of the patients, leading to produce more internal heat and complications. This is radiesthesia procedure that I usually use to measure the chakras energy centers. And here's to show you that yin and yang are two energies produced by the second chakra, and the blood is produced by the spleen, and the chi is produced by the first and the fourth chakra, and the heart meridian is to regulate the flow of the blood inside the vessels. Here's the research that I did in my clinic from 2015 to 2020, showing that 90% measuring 1,000 chakras, I could analyze 409 files of my patients at the beginning of the pandemic last year when my clinic was closed. I asked my secretaries to do this search of all the files, and the result of this research was that 90% of all my patients had no energy from chakra 1 to 6. And the majority have energy in the 7th chakra, that is the spiritual chakra. But you can see that even children, very young children, babies, and children and adolescents and young adults or older patients, they also have the same results. Even they do not have comorbidities such as diabetes, hypertension, myocardial infarction, or stroke, or history of cancer or other disease, but they have common diagnoses such as anxiety, depression, headache, anxiety, knee pain. This means that patients with common diagnoses, pain condition, or other kinds of diagnosis, if you do not search for the energy problems, you can not treat the entire patient, in the whole patient. And that's why if you only treat the symptoms, that's anxiety, depression, or headache, but do not treat the root that are problems on the root of the tree, you are not treating the cause, but you are treating only the symptoms. And here are some energy imbalances that they have according to TCM. And some consideration about the majority of myocardial infarctions occurs in women, probably because woman has more blood deficiency, because woman has menstrual periods during the reproductive life, and they can have more deficiencies in blood compared with men that do not have a period, menstrual period every month. And they present a loss of blood every month, and this could be one of the causes that woman has more myocardial infarction without arterial obstruction, and they not often have an adequate diet to replenish these lack of blood every month that they have. And to treat the patients with myocardial infarction without arterial obstruction, you need to have these two medicines in mind, Western and TCM, because Western medicine is treating the local. It's very important treatment here to see if the patient have obstruction, or to save the patient's life at the acute phase. But in the after this treatment, you need to treat the root that are usually not treated nowadays by the Western medicine, and you need to treat the energy deficiencies to don't allow this patient to have another myocardial infarction without arterial obstruction, like in this patient reported in this study. Here is the publication of this presentation. You can search at the internet, it's online. And here's to show you the another presentation that I will do in next Cardiology Congress is about myocardial infarction without arterial obstruction in patients post-COVID-19 treatment. And this is why I'm saying that the use of high concentrated medication in patients with COVID-19 in acute treatment of COVID-19 could induce this kind of presentation after the acute phase of COVID-19 because of the use of the type of medication to treat this condition. And that's why the medication, the medication of choice to treat COVID-19 nowadays is the highly diluted medication to do not have such complications after. And the conclusion of this study is that the complete lack of energy in all the chakra is the reason for the myocardial infarction without arterial obstruction due to the stagnation of blood inside the coronary arteries. And the correct treatment, replenishing of this lack of energy is very important to prevent the evolution to myocardial infarction and future myocardial infarctions. And also to prevent another chronic disease, because all chronic disease came from these energy deficiencies that I'm presenting all other webinars and publications, saying that the root of all these chronic disease are in these chakras energy deficiencies that Western medicine cannot understand because they study only the materialized energy, but we have energy that's invisible that we need to understand that they exist and we need to treat also. And according to Hippocrates, healing is a matter of time, but sometimes it's also a matter of your opportunity. And you need to give the opportunity to this patient and save the patient's life and treat them accordingly, not treating them only part of the treatment. Thank you for your attention. If you have any question, I will be very happy.